Do you ever experience heartburn or get an acid taste in your mouth after you eat? Tired of popping pills to get rid of that burning sensation in your stomach? You're probably suffering from acid reflux. And here to tell us more about how to get rid of it in today's My Health series is Dr. Glenn Ihde. And good morning.
Nice to meet you.
I'm so glad you're here because I got to tell you, this is really something you hear about every single day. Acid reflux. People complain about it. It causes a lot of discomfort. First, let's talk about what it is and what causes it, doctor.
Well, acid reflux is when the fluid in the stomach gets into the esophagus. Most people think of it as acid getting to the esophagus, but sometimes it is an acid, sometimes it's enzyme, sometimes it's bile, but it causes this pain and burning that most people have experienced.
And what are the symptoms and risks involved?
And the most common thing is people feel that burning, that crushing chest sensation. Sometimes they get acid up into their mouth. It also causes a lot of coughing. Adult onset asthma is one of the most common causes of that is reflux. Can even cause pneumonia.
And I got to tell you, I could totally relate to this because my husband suffers from it. And he really does. And it's very painful. Sometimes even at night, doctor, he wakes up and he'll grab his chest and he tells me, sweetie, it's like I'm having a heart attack. And I say, really?
Yep.
And I've gotten him every PPI on the market that I could possibly find, and he still experiences the symptoms. So could he or someone else maybe have a more serious problem?
Well, they could. A lot of patients will go to the emergency room, get worked up for heart disease initially, and then once that's ruled out, we find out, yes, it's reflux disease and that needs to be treated. Wakes them up at night. That's the most common complaint, most common reason people look for treatments of their symptoms.
So is there a cure for chronic reflux?
Well, you know, most people treat reflux with medications, which treats the acid, but not the reflux itself. So if you want to treat the reflux, you have to fix the valve at the end of the esophagus, separates the fluid from the stomach from getting into the esophagus, and there's a new procedure to do that.
Is that surgery?
It's surgery, but it's incisionless. We go through the mouth with a device, and then we're able to create a fold of the stomach onto the esophagus the way the body is naturally supposed to be, and we recreate the natural valve at the end of the esophagus.
Okay, walk me through it. Pretend I'm a patient, and I'm one to say, oh, I don't like surgery, doctor. Tell me exactly what's going to happen to me that day if I go into the surgery.
You come into the hospital, you get an IV. We use the IV to make you sleepy. We pass this tube. It's got a camera on the end of it. We go down into the stomach, and we're able to look back up at the valve, and then we put this device in. The device will fold the stomach onto the esophagus and then place sutures all the way around. And then we're able to recreate the flap valve that's there where as the stomach fills, the front wall of the esophagus gets closed against the back wall of the esophagus, and that keeps the fluid from getting into the esophagus.
How successful is it?
About 70% of people are going to have very good results from this.
That's excellent. Is it outpatient, or does the patient have to stay overnight?
We usually have the patient stay overnight just to observe them. They may be sore for 2 or 3 days, but then after that, they feel pretty normal, can go back to their normal activities, go back to work. We do keep them on a diet for about 6 weeks just to let the sutures heal in so that it doesn't overstretch the sutures.
So after they're back to normal and those 6 weeks have passed, that person, like my husband, who's been sacrificing, let's say, the rice and black beans and the spicy sauces and the jalapeno peppers, can go back to eating them? Go back to eating the things you like to eat, stay off of the medication. Some people will have what we call physiologic reflux. In other words, they feel a little bit of reflux less than twice a week. It's sort of a cleansing mechanism for the esophagus. But then otherwise they're able to eat what they want to eat. Awesome. Yes, I'm going to have him give you a call. Thank you very much. Thank you, doctor. And if you'd like to learn more about this acid reflux procedure and how you can attend a free patient seminar at the Ihde Surgical Group PA, just log on to the website, dallasreflux.com. Sounds really interesting.